In emergency situations, people are not always able to make or express choices for their treatment. That means they may end up receiving treatment they didn't want, even if the healthcare professionals thought it was in their best interest. ReSPECT helps to change that. ReSPECT is a form that clinicians can use to record a person's preference for clinical care in the event of a future emergency. But it's much more than a form. It's about the conversations people have and the decisions they make in order to be better prepared. ReSPECT is available to everybody, but is particularly relevant for those people who have a long-term condition that will deteriorate over time, and for those who are elderly or frail. Let's talk about Joe. Joe has a progressive lung condition. He is visiting his GP following a recent admission to the hospital with an infective exacerbation of his condition. This was his third admission over the course of the past year. His GP asks Joe how he has been and gently explores his experience of being in hospital. She asks Joe whether he has thought about what he would want to happen in the event of an emergency happening again, and how Joe would feel about being readmitted to the hospital. They begin to discuss it further, using the ReSPECT form. Over several weeks, Joe, his family, and his carers have a number of conversations with his GP and with his respiratory consultant at his outpatient appointment. Collectively, they discuss Joe's condition and which treatments he would and wouldn't be prepared to receive. When Joe is happy with the decisions he has made, his ReSPECT form is checked and signed by his GP. Joe keeps the form in a folder where he stores all his important information about his health and well-being and what his preferences are in an emergency. This is kept in a safe place where his family, friends, carers, and neighbours can find it, and it is easily recognisable to emergency services. The presence of the document is flagged on his GP's computer system. A few months later, Joe's breathing rapidly deteriorates again, and he becomes very ill. His neighbour calls for an ambulance. The paramedic arrives and asks and checks with the neighbour if Joe has any care guidance, such as a ReSPECT form, and then checks what is documented. The paramedic uses the information to help them more easily decide on the best course of action for Joe's treatment, as Joe is struggling to speak. Joe is admitted to the hospital, and the doctor in ED asks to see his ReSPECT form and checks to see what the clinical recommendations are to guide appropriate care for Joe. He recovers from his infection, but on discharge is more frail. Before he is discharged home, the ward doctors talk to him about what Joe's thoughts are over future care in an emergency. They discuss Joe's stay and explain that he didn't tolerate a strong breathing machine during this admission. Joe agrees that he wouldn't want to try this again. Joe feels that he would prefer to be cared for at home and avoid hospital again if he can, but he asks about antibiotics. The ward doctor explains about antibiotics in the community and that this is sensible to consider. Joe's GP visits him at home after his discharge with his family. They review his preferences about his options for care. They both agree with the plan to focus on care at home. She explains about a team who can give antibiotics, even through a vein, in the community, and documents on his ReSPECT form that this is a reasonable consideration. The GP takes a photo of Joe's form, which will be securely transferred to his medical records. Joe has a further 2 episodes of infection at home, and the teams in and out of hours are able to arrange for appropriate community treatment. He becomes increasingly frail and decides to go to a residential care home. In the home, they ask and check that Joe has a ReSPECT form and are pleased to see that this has come with him. This is again reviewed with Joe, who states that he no longer wants to have infections actively managed, but would like to have medicines to keep his breathing comfortable and to die peacefully. The care home staff, alongside Joe's GP, talk to Joe about the little things that matter to him: time with his family, watching the rugby, and a tot of whiskey every night. Joe's GP updates his ReSPECT form to reflect his changing wishes and uploads this to his electronic patient record. When Joe becomes ill again, the care home staff contact the GP and district nurses directly, who visit to review his condition in line with his ReSPECT guidance. They are able to diagnose that Joe is dying, and with the staff maintain his comfort, and he dies peacefully in comfortable surroundings with his family by his side. The ReSPECT process puts people and those important to them at the heart of the decision-making process, enabling them to be involved in planning their own care so that their wishes are known and respected. The guidance can relate to both interventions that would and wouldn't be recommended for that person. It is a form used across all care settings and should be amended over time as people's wishes and circumstances change. Having conversations about what matters to you, your health issues and circumstances is important. If you have a ReSPECT form and it needs reviewing or updating, speak to your healthcare professional, such as your GP. If you do not have a ReSPECT form and would like to have a conversation, speak to your GP or specialist nurse.